8 symptoms of pancreatic cancer that will shock you. Many people are shocked to learn that pancreatic cancer takes more lives each year than breast cancer, yet it rarely receives the same level of public awareness or discussion. Despite its impact, this disease often stays in the shadows until it is already far advanced. Now imagine this for a moment. By the time you finish watching this video, you may be able to recognize several important warning signals that thousands of people overlook every single year. Pancreatic cancer is considered one of the most difficult cancers doctors face today. Part of the reason is its extremely low 5-year survival rate, which remains around 11%. That number alone reveals how dangerous and challenging this disease can be. Every year, more than 60,000 people in the United States are diagnosed with pancreatic cancer. And sadly, a large portion of those diagnoses come too late. Research shows that roughly 75% of patients fail to recognize the early symptoms until the disease has already progressed to a more advanced stage. But here is the part that truly surprises many people. In numerous cases, the body actually sends warning signals months before a diagnosis is ever made. The problem is that these signals often appear subtle, ordinary, and easy to dismiss. They hide in everyday discomforts that most people would never suspect are connected to something serious. Your pancreas is a small organ, roughly about the size of your hand. Yet despite its modest size, it performs some of the most critical tasks in your body. It quietly produces hormones that help regulate blood sugar and enzymes that allow your body to properly digest food. Without these processes working smoothly, survival itself would be impossible. However, the pancreas sits deep inside the abdomen, tucked behind other organs. Because of this hidden position, it is not easy to examine or detect problems early through routine checks. That is exactly why understanding the body's warning signals becomes so important. The more familiar you are with these signs, the greater the chance of noticing something unusual sooner rather than later. In this video, we will explore 8 surprising symptoms that may be linked to pancreatic cancer. Some of them might seem minor or unrelated at first glance. In fact, a few of these symptoms are so common that many people experience them without ever suspecting they could carry deeper meaning. You might even recognize 1 or 2 of them in your own life right now. And here is something even more fascinating. Recent research from Johns Hopkins University suggests that when just 3 of these symptoms appear together, the probability of identifying pancreatic cancer at an earlier stage may increase by as much as 68%. Understanding these signals could make a meaningful difference in how early this silent disease is detected. Disclaimer: this video is created for educational and informational purposes only and should not be considered medical advice. It is not intended to diagnose, treat, cure, or replace guidance from a qualified healthcare professional. If you have any medical concerns or notice unusual symptoms, always consult a licensed doctor or healthcare provider. Every piece of information shared in this video has been carefully researched and reviewed using reliable medical sources. For those who would like to explore the research in more detail, the source links are available in the description below this video. If you find this video helpful or informative, consider giving it a like and subscribing to the channel for more science-based health insights. Now let's begin with the first warning sign. Sign number 1. Dark yellow or brown urine. The color of your urine can reveal surprising clues about what may be happening inside your body. Sometimes, a small change in color can signal that an important internal process has been disrupted. When pancreatic cancer begins to develop, it can interfere with the bile duct and lead to a condition known as jaundice. Jaundice occurs when a substance called bilirubin starts to build up in the bloodstream. Bilirubin is a yellowish pigment produced when your body naturally breaks down old red blood cells. Under normal circumstances, bilirubin is processed by the liver and eventually leaves the body through stool. This is actually what gives stool its characteristic brown color. However, when pancreatic cancer blocks or compresses the bile duct, the normal flow of bile becomes obstructed. When this pathway is disrupted, bilirubin can no longer move through the digestive system as it normally would. As a result, your body begins searching for alternative ways to remove the excess bilirubin. One of those pathways is through your urine. Even if you are drinking enough fluids and staying well hydrated, your urine may suddenly appear darker than usual. Many people describe it as a deep yellow-brownish color, or even similar to cola or strong brewed tea. This change may appear subtle at first, but it can be an important signal that something deeper is occurring inside the body. Unfortunately, many individuals overlook this symptom. They may assume it is simply the result of dehydration, vitamins, medications, or recent dietary changes. While those explanations are sometimes correct, persistent dark urine should never be ignored. If this unusual color continues for several days despite adequate hydration, it is important to seek medical evaluation. Doctors often pay close attention to this symptom because it may appear before more obvious signs of jaundice develop. Those visible signs include yellowing of the skin or the whites of the eyes. Recognizing this early change in urine color could potentially lead to earlier investigation and diagnosis. Sign number 2, abdominal or back pain. Pain associated with pancreatic cancer often carries specific patterns that doctors pay close attention to. The location and nature of the discomfort can provide important clues about where a tumor may be developing within the pancreas. When cancer forms in the body or tail portion of the pancreas, patients frequently report a very distinctive type of pain. This pain often begins as a dull, persistent ache deep within the upper abdomen. Rather than feeling like a typical stomach ache, the sensation may feel deeper and more difficult to pinpoint. Many patients describe the discomfort as if it originates from somewhere inside the center of the body. One of the unique features of this pain is that it often spreads or radiates toward the back. Some individuals say it feels like a band of pressure wrapping around the middle of the torso. Others describe it as a steady ache that travels from the upper stomach through to the spine. Unlike common digestive discomfort, this pain often becomes more noticeable after eating a meal. It may also worsen when lying flat on your back. Some people find that leaning forward slightly can provide temporary relief. This happens because the pancreas sits within a dense network of nerves and nearby organs. As a tumor grows, it can press against surrounding tissues and nerve pathways. This pressure can trigger persistent pain signals that gradually become more noticeable. Patients often describe the sensation in different ways. Some say it feels like a dull, gnawing discomfort that never fully disappears. Others compare it to a constant, heavy pressure in the upper abdomen. The pattern of the pain is also important. In the early stages, the discomfort may appear occasionally and then fade for a period of time. This temporary relief can make it easy to dismiss the symptom as a minor digestive issue. However, as the disease progresses, the pain typically becomes more frequent and more intense. It may begin to interfere with sleep, daily movement, or normal activities. Doctors carefully analyze the characteristics of this pain when evaluating patients. The location, timing, and progression of the discomfort help physicians distinguish pancreatic cancer from other digestive conditions. Understanding these patterns may help people recognize when persistent pain deserves closer medical attention. The timing, location, and quality of discomfort can offer doctors important clues during diagnosis. These subtle details often help physicians distinguish between routine digestive problems and more serious underlying conditions. Sign number 3, gas or persistent bloating. Pancreatic cancer can influence digestion in ways that many people do not immediately associate with the pancreas. As a tumor begins to grow, it may disrupt the pancreas's normal ability to assist with digestion. This disruption can lead to uncomfortable sensations such as persistent bloating, pressure, or a feeling of fullness. Your pancreas plays a key role in digestion by producing enzymes that help break down the food you eat. These enzymes allow your body to properly process fats, proteins, and carbohydrates. When pancreatic function becomes impaired, this digestive process no longer works as efficiently. As a result, you might begin to feel unusually full after eating only a small amount of food. This experience is often referred to as early satiety, meaning you feel satisfied or full far sooner than expected. One reason this happens is that a tumor may press against nearby organs, such as the stomach or the upper part of the small intestine. That pressure can reduce the stomach's ability to expand normally during meals. the bloating associated with pancreatic cancer often feels different from the occasional bloating caused by diet or gas. Instead of appearing briefly and resolving quickly, it may linger for long periods of time. Common remedies like antacids, digestive tablets, or simple dietary adjustments may provide little or no relief. Your abdomen may feel tight, swollen, or uncomfortable even if you have eaten very little. Some people describe the sensation as a persistent heaviness in the stomach area. Although the discomfort may become more noticeable after meals, it can also remain present throughout the day. This feeling is not merely inconvenient. It can be a signal from the body that something within the digestive system is not functioning normally. Many individuals initially assume these symptoms are related to stress, indigestion, or common gastrointestinal issues. However, when bloating and early fullness continue for several weeks, it becomes important to seek medical advice. Sign number 4. Enlargement of the gallbladder or liver. Pancreatic cancer can sometimes affect nearby organs through a chain reaction within the digestive system. Two organs that may be influenced are the gallbladder and the liver. This occurs because pancreatic tumors often block or compress the bile duct. The bile duct is a vital channel that carries bile from the liver to the small intestine. Bile plays a crucial role in digesting fats and removing certain waste products from the body. When this pathway becomes blocked, bile can no longer flow normally through the digestive system. Instead, it begins to accumulate upstream. Your gallbladder, which is normally about the size of a small pear, may gradually enlarge as bile builds up inside it. The gallbladder continues to collect bile from the liver, but it cannot release it effectively due to the obstruction. Over time, this causes the organ to stretch and expand. In a similar way, the liver may also swell when bile begins to accumulate within its internal ducts. Doctors may sometimes detect this swelling during a physical examination. It may feel like a firm enlargement just beneath the right side of the rib cage. Modern medical imaging tools make these changes easier to identify. Tests such as ultrasound, CT scans, and MRI scans can reveal enlargement of these organs. These organs function in a delicate and interconnected system. When one component is disrupted, the effects often ripple outward to other structures. Recognizing these connections allows doctors to piece together important diagnostic clues. During medical evaluations, healthcare providers frequently assess the liver and gallbladder for signs of enlargement or obstruction. Such findings can sometimes point toward underlying pancreatic disease. Sign number 5. Blood clots. One lesser-known complication of pancreatic cancer involves its impact on the body's blood clotting system. Certain cancers can make the blood more likely to clot than usual. This condition is called hypercoagulability, meaning the blood has an increased tendency to form clots. In pancreatic cancer, these clots often develop in the deep veins of the legs. This condition is known as deep vein thrombosis, or DVT. Symptoms of DVT may include swelling in one leg, warmth in the affected area, redness, and tenderness. The situation becomes more dangerous if part of the clot breaks loose and travels through the bloodstream. If the clot reaches the lungs, it can cause a serious condition called pulmonary embolism. A pulmonary embolism can block blood flow in the lungs and quickly become life-threatening. Pancreatic tumors can trigger clot formation because they release inflammatory substances into the bloodstream. These substances interfere with the body's natural clotting balance. The result is an environment where clots form more easily than normal. Warning signs of a pulmonary embolism may include sudden shortness of breath. Chest pain that becomes worse when taking a deep breath is another possible sign. A rapid or irregular heartbeat may also occur. These symptoms require urgent medical attention because they can develop rapidly. Sign number 6. Fever and chills. Episodes of fever may sometimes appear in people with pancreatic cancer. These temperature changes often reflect the body's inflammatory response to disease. When the pancreas becomes inflamed, the immune system activates defense mechanisms. This process can cause fluctuations in body temperature. Unlike the steady fever that accompanies many infections, these temperature spikes may appear irregular. You might suddenly feel extremely cold and begin shivering. Later, the episode may shift into a high fever. This cycle of chills followed by fever can repeat itself over time. In pancreatic cancer, the combination of bile duct blockage and pancreatic inflammation can intensify this response. The body may be dealing simultaneously with inflammation, obstruction, and the presence of cancer cells. These fevers are often accompanied by night sweats, fatigue, and general discomfort. Unlike viral illnesses that usually improve within several days, these temperature fluctuations may persist or repeatedly return. Sign number 7. Persistent fatigue or physical weakness. Another common symptom associated with pancreatic cancer is profound exhaustion. This type of fatigue goes far beyond the normal tiredness people feel after a long day. It is often described as an overwhelming lack of energy that does not improve with rest. Cancer cells require large amounts of energy and nutrients to grow. As they compete with healthy cells, the body's energy reserves become depleted. This can lead to a noticeable decline in physical strength. Activities that once felt routine may suddenly feel exhausting. Climbing a flight of stairs or carrying groceries may become unexpectedly difficult. This fatigue can also affect emotional well-being. Many people experience increased feelings of anxiety, sadness, or depression. Sleep patterns may become disrupted, leading to poor sleep quality. The combination of poor sleep and physical exhaustion creates a cycle that is difficult to break. Cancer-related fatigue is unique because it does not follow the normal pattern of exertion and recovery. Even after a full night of sleep, a person may wake up feeling drained. These gradual changes in energy can be easy to dismiss at first. People often attribute them to aging, stress, or a busy lifestyle. However, persistent, unexplained fatigue deserves medical evaluation. Sign number 8. Digestive disturbances. Pancreatic cancer can significantly disrupt digestion through several mechanisms. The pancreas produces enzymes that are essential for breaking down food. Without these enzymes, the body cannot properly digest fats, proteins, and carbohydrates. If a tumor interferes with enzyme production or blocks the pancreatic duct, digestion becomes impaired. Food may remain partially undigested in the stomach or intestines. This can lead to nausea, vomiting, and a constant feeling of digestive discomfort. Appetite may gradually decline because eating becomes unpleasant. As nutrient absorption decreases, unintended weight loss may occur. Over time, this can lead to nutritional deficiencies. Changes in stool appearance may also develop. Stools may appear pale, greasy, or unusually foul-smelling. This happens because fats are no longer being properly digested and absorbed. The undigested fat passes through the digestive tract and alters stool consistency. These digestive symptoms often develop gradually and may worsen over time. Understanding these 8 warning signs of pancreatic cancer may help increase awareness and encourage earlier medical evaluation. Recognizing changes in your body and seeking medical advice when symptoms persist can play an important role in early detection. If you found this information helpful, consider liking this video and subscribing to the channel for more science-based health content. There are additional videos on the screen that explore other important health topics you may find valuable. Your support helps us share critical health information with more people around the world.